The FDA never established that this pill remains effective beyond 8 weeks. Millions still take it every single
Thank
morning.
you.
For years, there is a pill sitting in medicine cabinets across America right now. Millions of people take it every single morning, before breakfast, before coffee, before the day even starts. It has become part of the routine, as automatic as brushing your teeth. For some people, it has been there for 3 years. For others, 5. For many, they have genuinely lost count. And almost nobody has ever sat down and read what the label actually says. Because here's the thing about omeprazole, it works. You take it, the burning stops, and life goes on. And when something works, you stop asking questions. But the questions are exactly what nobody's asking. Questions like, how long is this pill actually designed to be taken? Questions like, what is happening inside the body after month 6, after year 2, after year 5? Questions like, why does stopping it feel worse than starting it? This video is not about telling you what to do. It is about showing you what the FDA label says. What happens inside the body when a pill designed for 8 weeks becomes a permanent fixture in the morning routine? Because that information exists. It has always existed. It just never made it to the kitchen table. If you or someone you love takes this pill every day, stay with this. What comes next is what most people find out years too late. So what is omeprazole? Exactly. Your stomach is a processing machine. Its job every single day is to break down the food you eat. And to do that, it produces acid, strong acid. That acid is not a flaw in the human body, it is a feature. It breaks proteins apart so your intestines can absorb them. It kills bacteria that would otherwise survive inside you. It releases vitamins and minerals from food so your blood can carry them where they are needed. Now, in some people, that acid production goes wrong. Too much acid in the wrong place. It climbs into the esophagus, the tube connecting your mouth to your stomach. The esophagus has no protection against acid, so it burns. That is reflux. That is heartburn. That is the pain omeprazole was designed to stop. Omeprazole shuts off the tiny machines inside your stomach wall that produce acid, not temporarily, completely, until your body builds new ones to replace them. Less acid, less burning, less pain. For a stomach that has been damaged, that shutdown is genuinely necessary. It gives the tissue time to heal. The original plan was simple. Take it for a few weeks, let things heal, then stop. 8 weeks. That was the window. That was what the studies tested. That was what the manufacturers submitted to the FDA. What the FDA label actually says? This is not an opinion. This is not a health blog theory. This is what is written in the official FDA prescribing document for omeprazole. The label states, these are the exact words. The efficacy of omeprazole used for longer than 8 weeks has not been established. Read that again. The effectiveness of this pill beyond 8 weeks has not been established. The controlled clinical trials that supported this drug's approval did not extend beyond 12 months. 12 months is the outer edge of what was actually tested. Everything beyond that is territory that was never fully mapped. And yet, a significant portion of people prescribed omeprazole for short-term use are still taking it years later. Not because a doctor made a long-term plan, but because the refills kept coming. Because stopping caused symptoms to return. Because nobody asked the question out loud. The label also warns about fundic gland polyps, small growths that can form in the stomach lining with long-term use. And it states directly, use the lowest dose for the shortest duration. Those are the manufacturer's own words. Lowest dose, shortest duration, written in the document that comes with every prescription. Most people have never seen it. What happens inside the body over time? Your stomach acid does not just cause problems, it solves them. When you shut off acid production for months and then years, you are changing the entire environment of your digestive system. And that environment is responsible for unlocking nutrients from everything you eat. Magnesium. Magnesium runs over 300 processes in the human body. Your muscles, your heart, your brain, all depend on it daily. When stomach acid is suppressed long-term, the intestines lose some of their ability to absorb magnesium from food. A meta-analysis of 16 observational studies found that long-term omeprazole users have a 71% higher risk of developing low magnesium levels. The symptoms, cramps, fatigue, heart palpitations, poor sleep, are easy to blame on aging or stress. Almost nobody connects them to the pill taken every morning. Vitamin B12. Your stomach acid releases vitamin B12 from food so your body can absorb it. When acid is suppressed long-term, that release does not happen properly. Studies show that more than 3 years of omeprazole use can lead to measurable B12 deficiency. B12 deficiency does not announce itself quickly. It builds slowly, silently, over years. B12 maintains the protective sheath around your nerve cells. Without enough of it, nerve signals become unreliable. Memory slips, concentration fades, hands and feet develop tingling. In advanced deficiency, the neurological damage can become permanent, not temporary, permanent, from a deficiency that built quietly, while someone took their morning pill without knowing. Bone health. This one is written directly in the FDA label. Long-term PPI therapy, 1 year or longer, is associated with an increased risk of fractures of the hip, wrist, and spine. A meta-analysis of 24 studies found a 20% greater risk of hip fracture in long-term users compared to people who did not take the medication. Calcium absorption requires stomach acid to work properly. Less acid over years, and the calcium that should be going into your bones passes through your system unused. Bone density decreases slowly, quietly, without any symptoms, until a fall that should cause a bruise causes a fracture instead. The rebound effect. When omeprazole shuts off the acid pumps, the stomach fights back. It responds by building more acid-producing cells, more pumps, more capacity. This is called rebound acid hypersecretion. It means that when someone tries to stop after years of use, the acid returns harder than it ever was before they started. So they take the pill again, not because the original problem is still there, but because stopping has become painful. The body adapted, and now it depends on the pill to feel normal. What you can do. None of this means omeprazole is the enemy. For real acid damage, it is a genuinely important medication. What it means is that long-term use comes with nutritional consequences that are documented, measurable, and largely preventable. For magnesium, pumpkin seeds, almonds, dark leafy greens, and black beans are among the highest food sources available. Research commonly points to magnesium glycinate in citrate as forms that are more easily absorbed, though your doctor can help determine what is right for your situation. For B12, sublingual, B12 is widely discussed as an option that does not require stomach acid, entering the bloodstream directly and bypassing the absorption issue that long-term acid suppression can create. Many doctors recommend monitoring B12 levels in patients on long-term PPI therapy. For bones, calcium citrate is commonly discussed as a preferred option for people with reduced stomach acid since, unlike calcium carbonate, it does not require an acidic environment to absorb. Research suggests pairing it with vitamin D supports calcium absorption further. And the question's worth bringing to your doctor. Do I still need this at this dose, or can we reduce it gradually? Has anyone monitored my B12, magnesium, and calcium levels recently? Is there an underlying cause we have not fully addressed? These are not confrontational questions. They are what an informed patient asks. And a good doctor will welcome them. If this made you think differently about something in your medicine cabinet, subscribe to Med Truths. Every week we read the label so you don't have to. Here's the truth about omeprazole. It was designed as a short-term tool, 8 weeks, a bridge from pain to recovery. But for millions, it became permanent. Not by design, not by intention, just by the slow accumulation of refills and the absence of a conversation that should have happened. The pill meant to protect your stomach may be, over years, quietly withdrawing the minerals your bones depend on. The vitamin your nervous system cannot function without. The magnesium that keeps your heart in rhythm and your muscles at rest. That is not hidden information. It is in the label. It has always been there. You just needed someone to read it out loud.